transplant and CAR-T recipients don't do well after they develop COVID-19. Our CIBMTR registry analysis that examined 318 transplant recipients showed a mortality risk of 30% at 30 days after developing COVID-19. We identified lymphopenia, defined as absolute lymphocyte count less than 300 at the time of COVID-19 diagnosis, to be associated with higher mortality risk among survivors. Among autologous transplant, it was a little surprising finding, but patients who received autologous transplant for lymphoma had a higher mortality risk than those with myeloma. Among allogeneic transplant recipients, increased mortality risk was associated with older age, older than 50 years, male gender, and developing COVID-19 within a year of transplantation. Several other studies, Spanish, Italian, New York experience, they have published in a pretty similar mortality outcomes in transplant recipients. And, pretty consistent results are that increasing age, presence of active GvHD, development of COVID-19 early after transplantation are some of the predictors of mortality among transplant recipients. In a study from New York that examined 77 patients, the clinical outcomes were more favorable. And I think they were primarily because the study included only a handful of patients who had active GvHD, really. The same study included 5 CAR-T recipients. So the data on outcomes is, the body of data is larger in transplant recipients than CAR-T recipients. So the same study from New York also included 5 CAR-T recipients, all had B-cell non-Hodgkin lymphoma, all received CD19-directed CAR-T, 4 of them axi-cell, and 1 of them received T-Segen Luclucel. And I should mention there was this one very interesting case report. I think it was published a number of months ago in CID, an elderly patient with relapsed refractory myeloma who developed COVID-19 12 days after receiving a BCMA-targeted CAR-T. He remained persistently viremic for a number of months and eventually died. Post-mortem sequencing showed viral evolution with multiple sequence variants within the host, and that was concurrent with significantly diminished humoral and cellular immune responses. And there are some of the other studies have also shown poor outcomes in CAR-T recipients.